Hi friends, welcome back to Complete Medical Coding. Today let's discuss few more questions. Since few days we have not discussed few more questions. So let's look into some practice questions, some CPC previous year questions today. Okay. So friends, if you are new to the channel, please support me by subscribing to the channel. Let's move to the questions one by one. Moving on to the first question. A 7-year-old fell off the jungle gym and hit his head. The injury resulted in a subdural hematoma. He has been unconscious for last 1 hour. The surgeon drills 3 burr holes in the skull over the affected area. The durameter is exposed and the burr holes are used to access and drain the hematoma. What CPT and ICD-10 CM codes are reported? So here the patient is a 7-year-old boy, fell off the jungle gym and hit his head, and he is having subdural bleeding, hematoma, and he has been unconscious for 1 hour. And what is the procedure done here? Burr hole. The surgeon drills 3 burr holes in the skull. So 3 burr holes. Burr holes in the subdural area. Subdural, because of subdural hematoma. Okay. So burr holes is the procedure here. And what is the ICD code? The diagnosis? Fall and injury is a diagnosis. So anyway, let's look into the options one by one. First, let's look into the CPT codes, because there are only CPT codes. See, only one CPT in each options. Only 2 CPTs are mentioned. See, that is 61108 and 61154. Let's see which is the correct CPT code. 61108. Just open your CPT code book and take 61108. What is 61108? That is twist drill hole for subdural, intracerebral or ventricular puncture for evacuation and drainage of subdural hematoma. This is subdural hematoma, it's right, but this is not twist drill, this is burr hole. So 61108 is the incorrect CPT code. So what will be 61154? Burr hole with evacuation and drainage of hematoma, extradural or subdural. So that is our CPT code. Okay, 61154. Burr hole with evacuation and drainage of, burr hole or holes is mentioned. See, burr hole or in the bracket S. So burr hole. So whatever number of burr holes, you have to code only 61154. See option D, 61154 times 3 is mentioned. So that will make you confused. That's why you have to read the description carefully. So in CPT code 61154, it's mentioned burr hole or burr holes. Okay. Burr holes in bracket S is mentioned. So it means burr holes. Whatever n number of burr holes, you have to code only 61154. So you already got the answer now in the, from these 4 options, right? Option B, 61154 is the only one. Then the other option D is times 3. So which is wrong. Anyway, let's check the ICD code also in option B. What is S06.5x3A? S06.5x3A. ICD code. It means traumatic subdural hemorrhage with loss of consciousness of 1 hour to 5 hours 59 minutes initial encounter. Yes, this is 1 hour. See, time is also mentioned. And the patient was unconscious for last 1 hour. So here, traumatic subdural hemorrhage with loss of consciousness from 1 hour to up to 5 hours 59 minutes. Means up to less than 6 hours. From 6 hours it will be another code. So that is what it is, S code. And what is W code? W09.2xxa. How it happened? Okay, fall on from jungle gym, initial encounter. So that is W09.2xxa. So we already got the answer as option B. Okay, CPT code is 61154 along with S code and W code as the ICD codes. Now let's look in the second question. A 5-year-old patient has a fractured radius. The orthopedist provides moderate sedation and the reduction. The time is documented as 21 minutes. What CPT code is reported for the moderate sedation? So here procedure done is moderate sedation and the reduction. Okay. So we have to, what is the question? We have to code for the moderate sedation. What CPT code is reported for moderate sedation? Okay. So go to option A, 99156. See, all these are 99 codes, medicine codes. Okay, 99 starting from 99151, 99152, 99155 and 99156. So let's check all those codes. So first take 99151. What is 99151? Moderate sedation services provided by the same physician or other qualified healthcare professional performing the diagnostic or therapeutic service that the sedation supports, requiring the presence of an independent trained observer. No, here there is no independent trained observer. Okay, to assist in the monitoring of patients. Initial 15 minutes of intra-service time. No, that is not the correct code. What is 99152? Same description with initial 15 minutes of intra-service time, patient age 5 years or older. In 99151, patient younger than 5 years. So that is not the answer. 99152, 5 years or older. This is 5-year-old patient. So, but the description is incorrect. So that is not the correct one. What is 99155? Moderate sedation services provided by physician or other qualified healthcare professional other than the physician or other qualified healthcare professional performing the diagnostic or therapeutic service and sedation supports initial 15 minutes of intra-service time. Patient younger than 5 years. No, this is 5-year of age. So what is 99156? Same description. Initial 15 minutes of intra-service time. Patient age 5 years or older. 5 years or older. So you have to code for the 5 years. And here the time is mentioned as 15 minutes. Our time is 21 minutes. So it means greater than 15 minutes. But what is the add-on code 99157? Each additional 15 minutes. So 15 plus 15, it should be 30. Then only you can code the add-on. You can add the add-on code, right? So here since it's 21 minutes, you can code only the primary code, which is 99156. Okay. So in CPT codes 99151 and 152, in that description, it was mentioned requiring the presence of an independent trained observer. If in the question it's mentioned like that, then you have to code those codes, either 99151 or 152. Okay. For monitoring, see, requiring the presence of an independent trained observer to assist in the monitoring of patient's level of consciousness. Nothing is mentioned for an additional observer, which is correctly mentioned in the codes 99155 and 156. And according to the age, you have to code 99156. So our correct answer is option A, 99156. Okay. Moving to the third question. A grade 1 high velocity open right femur shaft fracture was inferred when a 13-year-old pedestrian was hit by a car. He was taken to the operating room within 4 hours of injury for thorough irrigation and debridement, including excision of devitalized bone. The patient was then re-prepped and re-draped and repositioned. Intramedullary loading was then carried out with proximal and distal locking screws. How will the codes are reported? So, what are the procedure done here? Locking screws, open treatment is being done, and then debridement is being done. Okay. Let's look into the options CPT codes one by one. Anyway, if you can see, if you take the CPT code for open treatment, only two codes are here, 27506 and 27507. Let's check which is the correct one. So just open 27506. What is 27506? Open treatment of femoral shaft fracture with or without external fixation, with insertion of intramedullary implant, with or without cerclage and or locking screws. So this is an open treatment. Okay, this is the exact description of what is mentioned in our question. Open treatment of femoral shaft fracture with or without external fixation. Okay, and then here in our question it's mentioned at last intramedullary roding was then carried out with proximal and distal locking screws. That is also included in the description, CPT description, in the code 27506. With or without, see, with insertion of intramedullary implant, with or without locking screws. What is 27507? That is just mentioned, open treatment of femoral shaft fracture with the plate or screws, with or without cerclage. Here it's not mentioned with or without external fixation or intramedullary implant. Nothing is mentioned in CPT code 27507. So what exactly is mentioned in our question? As such, it is there in the CPT code 27506. So our correct open treatment code is 27506. So we can skip options C and D. So from option A and B, what is the other procedure done? Debridement done, right? In the question. For thorough irrigation and debridement, including excision of devitalized bone. So you have to code for debridement also. So what is there in option A? 11044. 11044. And in option B, 11012. So you have to check which is correct one. What is 11044? Debridement bone includes epidermis, dermis, subcutaneous tissue, muscle and fascia if performed first 20 square centimeter or less. And what is 11012? Debridement including removal of foreign material at the site of an open fracture and or open dislocation. Example, excisional debridement, skin, subcutaneous tissue, muscle fascia and muscle. Yes, this is the correct CPT code, right? Because this is the debridement and removal of foreign material at site of an open fracture. And excisional debridement, that is also mentioned. See, including excision of devitalized bone is mentioned in our question. So you have to code this one, 11012. So what is 11012? See, debridement including removal of foreign material and open dislocation. Example, excisional debridement, skin, subcutaneous tissue, muscle fascia, muscle and bone. Not only muscle fascia, muscle and bone. Excision of devitalized bone as per our question. So this is the correct CPT code 11012. So we already got the answer, right? As option B. Still, so you have to code with modifier 51. 11012. What is modifier 51? Multiple procedure. So here multiple procedures are carried out, right? Because debridement as well as open treatment. So multiple procedure. So you have to code with modifier 51. Now what is the ICD code in option B? Anyway, we got the answer, but still you have to check the ICD codes as well. What is the ICD code? S72.301B. S72.301B. Unspecified fracture of shaft of right femur, initial encounter for open fracture type 1 or 2. See, it's clearly mentioned as such in the question. This is an open fracture, grade 1, means type 1. And it happened in the shaft of right femur. See, right femur shaft fracture. So, this is the correct ICD code, S72.301B, unspecified fracture of shaft of right femur, initial encounter for open fracture, type 1. Now, what is the other ICD? V03.10XA. V03.10XA, where it happened, how it happened, or to whom it happened, that you have to mention. Pedestrian on foot injured, how it happened? The patient was a pedestrian. So, pedestrian on foot, injured in collision with car, pickup truck or van in traffic accident, initial encounter. So, that is also we have to mention. Okay. So these are the correct ICD codes. So our correct answer is option B. Moving on to the fourth question. A kidney transplant patient with a diagnosis of hypertensive heart disease without heart failure and stage 4 CKD, chronic kidney disease, received an ultrasound without duplex Doppler to check the overall blood flow of the kidney. What are the correct CPT and ICD codes for this encounter? So here the patient is a kidney transplant patient with hypertensive heart disease. So all these are diagnoses, okay? Hypertensive heart disease without heart failure. And then stage 4 CKD, chronic kidney disease. And what is the procedure done? Ultrasound without duplex to check the blood flow of the kidney. So ultrasound without duplex Doppler. So here, if you want, you can first go with the exact ICD code or else the CPT code, because see, if you can check in the options, in all the options there are 3 ICD codes. In that 2 ICD codes are common, N18.4 and Z94.0. These are common in all 4 options. See, I am just explaining how you can save your time during the examination. Okay. So it means N code and Z code is common for all the options. So you have to check the correct I code only for the hypertension code. Whichever is correct, only that you have to check. Okay. So what is I10, I13.10 and I13.0? These are the 3 I codes mentioned. What is I13 what is there in first option? I13.10. What is I13.10? Hypertensive heart and chronic kidney disease without heart failure with stage 1 through stage 4 chronic kidney disease or unspecified chronic kidney disease. This is what we need, right? Because the patient is a hypertensive heart disease, chronic kidney disease without heart failure, stage 1 to stage 4 chronic kidney disease. The patient is having here stage 4 chronic kidney disease. So everything is mentioned in this code I13.10. So this will be the exact one. If you want, you can check the other code also. Just I13.0. There is no 10, it's I13.0. If you can check I13.0, hypertensive heart and chronic kidney disease with the heart failure. Here in our option, in our question, it is without heart failure. So it will be I13.10 only. Okay. And in the last option D, I10, it means just hypertension. So that also we cannot code. So our exact ICD code is I13.10. And other 2 codes which are common, N18.4. What is N18.4? Chronic kidney disease stage 4. And Z94.0 means kidney transplant status the patient is having. The patient is a kidney transplanted patient. So now we have to check the CPT codes. So which will be our CPT codes that we need to check? We need to check only option A and C, right? Because the ICD in option B and D is incorrect. So just go to options A and C. What are the CPT codes? 76775 and 76776. From this you have to find out which is the correct CPT. What is 76775? Ultrasound retroperitoneal, example renal aorta nodes, real time with image documentation, limited. And what is 76776? Ultrasound transplanted kidney, real time and duplex Doppler with image documentation. This is with the duplex Doppler, 76776. But in our question, it is clearly mentioned ultrasound without duplex Doppler. That is why 76775 code is limited. So our correct answer is option C. You have to code 76775. Okay. So answer is option C, 76775 along with I13.10, N18.4 and Z94.0. Moving on to the fifth question. Sheila presents to her primary care physician for management of her degenerative osteoarthritis in her right wrist. The physician performs an injection of 1 mg Synvisc in her right wrist joint. What CPT and ICD-10 codes are reported for the service? So here osteoarthritis of right wrist, degenerative osteoarthritis. And what is the procedure done here? Injection given, injection of 1 mg Synvisc in her right wrist joint. So let's check the ICD code first. So what is the first ICD code? M19.231. M19.231 is secondary osteoarthritis right wrist. And what is M19.031? Primary osteoarthritis right wrist. Here it's not mentioned that secondary osteoarthritis. It's just degenerative osteoarthritis mentioned. So it means it's a primary osteoarthritis. So you have to code M19.031, right? So now you have to check the CPT codes, options B and C. 20526 and 20605. What is 20526? Injection therapeutic carpal tunnel. And what is 20605? 20605 is arthrocentesis, aspiration and or injection, intermediate joint or bursa. Example, temporomandibular, wrist, elbow, ankle. See, wrist is mentioned in option in code 20605. And this is aspiration injection, arthrocentesis, okay, without ultrasound guidance. So our correct CPT code is 20605 with primary osteoarthritis of right wrist, ICD code. So our correct answer is option C, 20605 and ICD M19.031. Okay. So friends, hope you liked the video. If you have any queries, please mark it in the comments and I'll be replying back to you as soon as possible. So if you are new to the channel, please support me by subscribing to the channel. And if you like the video, please like and share. And thank you so much friends for supporting me. And please stay tuned for more videos, more questions. Okay. Thank you so much. Bye. Take care.